for the next 36 hours. I am the Health Commissioner for New York City, and I'm also joined this morning by Dr. Auxidis Barbeau, who will soon be the Acting Health Commissioner and also is a pediatrician by training. And I'm also very pleased to be joined by Dr. David Rosner, who has been a leader in the field of assessing the public health impact of lead. He is a historian of public health, who's written books on the subject, and we're very pleased that you can join us today, David, to say a few words as well this morning. We're here today to talk about elevated blood lead levels in children here in New York City. I want to begin by acknowledging that there have been a lot of numbers swirling around and that people have been confused by these numbers. The Health Department is a data-driven organization. We live and breathe data, and we want to do our best to clarify the numbers today by talking you through some reports that we are making available and then answering your questions. I want to let you know in advance that going through these numbers will take a bit of time. I have a presentation for you that I expect will take about 20 minutes, and then we will be able to open for questions. Before I get started, I want to acknowledge our team, our Healthy Homes program, which is among the best in the country. It's led by Deputy Commissioner for Environmental Health, Corinne Schiff, and the Healthy Homes Director, Andrew Fasciano. I also want to acknowledge Deb Nagin, who directed the Healthy Homes program until the end of June of this year, and who helped make the program a national model. New York City has made tremendous progress in driving down child blood lead levels, and this is due to the city's strong laws, policies, and programs, including our own Healthy Homes program, that have all contributed to this success. Since 2005, when following on Local Law 1, the Health Department began making annual mandated reports on elevated lead levels in the city has seen a 90% reduction in the number of children who are under the age of 6 who have elevated blood lead levels, using here the cut point of 5 micrograms per deciliter. That translates into 33,000 fewer children each year who have an elevated blood lead level. But we know that there is still more work to be done. And as announced on July 1st, the city has reduced the threshold for environmental investigations for all children under the age of 18 to a lead level of 5 micrograms per deciliter. This is going to expand the Health Department's investigations from about 850 cases a year to more than 5,000 cases, and we're working to rapidly hire and train additional staff that is required to meet this expansion. With this new intervention level, the city will continue to be a national leader in protecting children from exposure to lead. As you know, since 2005, the Health Department has issued an annual report to the City Council on the number of children in New York City with elevated blood lead levels, and these reports are posted on our website. But in view of the recent interest in the issue, we've made a few changes. And today we're also debuting a quarterly report, which will join our annual report online. We are now breaking out the numbers by private housing and New York City Housing Authority or public housing. And so now I want to get to the new quarterly report, which we're making available to you today. Now, I'm going to begin by going over data for children under the age of 18 who have blood lead levels at or above 5 micrograms per deciliter. This graph shows the number of children by year and by housing type. It begins in 2010 and ends with the first 2 quarters of 2018. I would note that the 2018 data may change. They are subject to revision, but they are our most recent and most complete data for the year 2018. These blue bars here show the number of children in NYCHA housing who had blood lead levels at or above 5 micrograms per deciliter. As you can see, that number began in 2010 at 517, and for our most recent annual figure stands at 160. This represents a substantial decline, about 69%. I'm showing you now the added bars of children in private housing. I really must note to you, which I hope you can also see visually, that the proportion of children with elevated blood lead levels in private housing constitute the vast majority of children in our city who have elevated blood lead levels. There in red, you can see the total numbers for the entire city. The number of children in public housing or NYCHA housing usually runs about 3% of the total children who have elevated blood lead levels. 97% of those children in general, year after year, are in private housing. In 2017, more than 362,000 children under the age of 18 were tested for blood lead in New York City. This precise number was 362,119. And of these, 5,317 children had a blood lead level that was 5 micrograms per deciliter or higher. That means that of the children tested for blood lead, 1.5% had an elevation above 5 micrograms per deciliter. And I don't think I need to do the math for you, but that means 98.5% of children had blood lead levels below that. Of the children with blood lead levels of 5 micrograms per deciliter or above, 5,000, this is the number here, let me show you this number here, 5,157 were in private housing, that's 97%, and 160 or 3% were in public housing. By any measure, you can see that the numbers of children with elevated blood lead levels has gone down. These numbers, I want you to be careful, represents only half a year. They've gone down year on year since we have been collecting data separately by housing type for children in New York City. The children in NYCHA here, I'm now going to show you a different way of looking at the data. I've just told you the total numbers, and now I'm going to give you the rates. And these are the number of children under the age of 18 per 1,000 tested. So this is a rate, and what it shows you here is the private housing, here is public housing, and by any measure, you can see that we have a disproportionately low rate of elevated blood lead levels in children in public housing. About 6% of children citywide live in public housing, but as you've heard me say, about 3% have elevated blood lead levels. If they had the same risk as children in private housing, they would have elevations in line with their proportion in the population. But instead, the proportion is half what would be expected if the children had the same risk as children citywide. And if that's confusing to anybody, I'm happy to come back to it during the question and answer. But just to put it differently, children in public housing represent 6% of the children under 6 who've tested for blood lead levels and only 3% of the children found to have elevated blood lead levels. So this difference in risk is likely due to the fact that the housing stock in private housing is older in general than the housing stock in public housing or NYCHA housing, because homes built before 1950, when lead-based paint was in very common use, are more likely to be private housing. And I know that we've gotten numbers of questions in the past weeks about the testing rates of, and some concerns have been raised that whether children in public housing may not be as likely to have a blood lead test as a child who lives in private housing. I'm not going to be showing you the data today, but I can tell you that we've looked carefully at this question. It's a complex analysis, but if we take the children, for example, born in 2013, and we say we want to see by the time that child reaches the age of 3, did they have a blood lead test done? We find that on average in the citywide, about 80% of children are getting blood lead tests, but the number for children in private housing is 74%, and the proportion for children in public housing is 88%. This is 88% of children born in 2013. By the time they reach their third birthday, 88% of children in public housing had a blood lead test, and 74% of children in private housing. I also should add that this is, compared to other jurisdictions, is a high testing rate. New York City does quite well in having children tested, but of course we would like to see every child who should be tested have a blood lead level obtained. The other thing that, just going back, excuse me, I got ahead of myself. I wanted to make this other point about these data here. It might be tempting to add these totals, the red numbers, from year to year, and to therefore get the total from 2010 until mid-2018 by adding up those numbers in red. But that would be a mistake, because each year we look at the number of children who have an elevated blood lead level. But a child may appear with an elevated blood lead level in more than 1 year. And so that results in double counting of some children. If a child has a very high blood lead level, for example, it may still remain above 5 over 2-year time periods. And so you can't add up these numbers and get the correct number of unique children who had an elevated blood lead level. And I think I'll come back to that a little later. I was then showing you the rates, which are another way of looking at blood lead levels of 5 micrograms and above. That was private housing. This is NYCHA housing. And again, you can see that the NYCHA housing children appear to be at lower risk, presumably because of lower rates of exposure to lead paint, which remains the leading exposure that we associate with elevated blood lead levels. Now I'm going to show you a chart that looks pretty complicated, and I'm going to take a moment to talk through this. Again, these tiny bars at the bottom here represent NYCHA housing. Again, of the children with elevated blood lead levels citywide, 97% are in private housing, 3% thereabouts, a little bit of variation year to year in NYCHA housing. And here I want to just show you that there's variability in the quarterly testing rates. The third quarter, can you all see this when I bring the pointer up? You can't. Oh dear. Excuse me, I'm going to turn around. Here, you can see here that the third quarters, which each quarter of the year is in the same color. In the third quarter, there are generally more elevated blood lead levels reported than in any other quarter of the year. And this is for a number of reasons. In the summer months, kids are more likely to go to the doctor, get a test. Going back to school, they may be more likely to get that test done in the third quarter of the year. The summer months are also periods when children may have more exposures to lead paint hazards, windows being pushed up and down more. But so it's very important in looking at these quarterly data that you only compare like quarters to each other. So here, this like quarter to this like quarter to this like quarter to this like quarter is the right way to look at these data. Otherwise, it looks like the data are simply bouncing around because you don't take into account the variation that seems to happen year on year. So in April to June of, this is this quarter here, of 2018, you see a total of 1,223 children under the age of 18 with a blood lead level of 5 micrograms per deciliter, and this is a 7% reduction compared to the quarter. So quarter on quarter, comparing like quarters to each other, we continue to see the downward trend that I have been describing to you. Okay, now I'm going to turn to the 6-year-olds. And we particularly concern ourselves with children under 6 because small children are the ones that are at the highest risk of lead exposure. And this is reflected in the fact that the vast majority of children tested for blood lead levels in New York City are under 6. About 80% of them are under 6. And it's behaviorally based. As anybody knows who knows children who are, especially children under the age of 3, these are children who learn about the world with their hands and their mouths, and they are at risk of exposure in a way that older children are not. Again, these are the data for children in public housing, NYCHA housing. These are the data for children under the age of 6 in private housing, and the totals are given at the top of the bar in red. Again, the thing to notice here, and I wish I didn't realize that my pointer wasn't working that I have on the computer, but this is the same trend that we noticed for the under 18-year-olds. We also noticed for the under 6-year-olds. And again, we've calculated the rates. These are number of children with a blood lead level of 5 micrograms or greater per 1,000 tested. This is the private housing, and this is NYCHA housing here. In 2017, the number of children under 6 who had blood lead levels at or above 5 micrograms per deciliter was 4,000. I guess I should go back here. 4,261, and that represents a 69% decline compared to 2010, and a 14% decline compared to the year before. So we've seen a consistent and enduring downward trend in the number of children who have elevated blood lead levels by either numbers or by rates. All right, I think I'm coming up now to my last data slide. And these are data that we're presenting for the first time by borough. And this reflects the fact that we've gotten numbers of questions of people on borough-specific data. These represent the children under the age of 18 with blood lead levels at or above 5 micrograms per deciliter. And these empty boxes here are the totals from 2017. And then this is a nice visual way of showing how we're filling in those numbers as we collect them quarterly for 2018. The solid color here represents children in private housing. This sliver, which you may have trouble seeing from the back because it's such a small number when we look at 2/4 of data, are children living in public housing or children who are NYCHA associated, meaning that they spend substantial time in NYCHA housing. And you can see this is a way visually of seeing sort of how we are progressing in 2018 towards the totals that were seen in 2017. Again, they show, it shows graphically the fact that overwhelmingly children exposed to lead and who have elevated blood lead levels are children who live in private housing. I want to take a few minutes to say something about how lead poisoning is addressed as a medical problem. And I may turn to Dr. Barbeau to add to this. As I mentioned, she's a pediatrician. I'm an adult physician, an internist by training, and she's actually taken care of children who have had elevated blood lead levels. But I think it's very important to understand that except for very high levels of blood lead, we don't engage in any medical intervention. The children who have 45 micrograms per deciliter or higher may be chelated, may actually have medical treatment, but we rarely see children at those sorts of levels in our city any longer. For the vast majority of children with elevations that are 5 micrograms per deciliter or higher, the treatment is one, to identify a potential environmental source, and that is what is done with an environmental investigation. It means interviewing the family and identifying where the child spends time and what products they might be exposed to, and then testing their home for the presence of lead, and remediating the exposure when it's found, whatever it is, and then letting the body do its work. The children will excrete lead from their bodies, and their blood lead levels will go down. When children are under surveillance by the health department, we don't just go see them once. The health department, the Healthy Homes program, keeps track of that child to ensure that their blood level, his or her blood level, is going down. And if the lead level is not going down, that will trigger another cycle of investigation of a potential environmental source. So the vast majority of children have an environmental investigation, and then they simply get better and grow up and stop putting stuff in their mouths, and we work hard to identify any unsafe exposures. So maybe I should ask Dr. Barbeau if you'd like to add anything to what I've covered, and then I'll turn it over to Dr. Rosner. Dr. Barbeau.
Dr. Bassett, you covered it all. The only thing that we want to do is remind New Yorkers that if they have questions about lead poisoning, they can call our Healthy Homes program hotline at 646-632-6023. We also encourage New Yorkers to report unsafe work or practices or peeling paint in their homes by calling 311. And lastly, reminding folks they can visit our website, nyc.gov/lead, for much more information about lead and how to treat it.
Thank you, Dr. Barbeau. And your words remind me to just reiterate again that as somebody who's worked in public health for over 30 years, I think of lead exposure as a problem of housing. And that the fact is that we have lead in our environment, but it becomes of hugely increased risk to children when we have dilapidated or poorly maintained housing. So I want to just reiterate again that everyone should be aware that regardless of who their landlord is, if they have peeling paint, they should call 311 and complain about it. They have the right in New York City. It's a right under law for every child who's under the age of 6 to live in a lead-safe environment. All right, Dr. Rosner, over to you.
Thank you very much. I'm not going to go through any numbers at all, I promise. I'm a historian who's spent a better part of his career looking at this bizarre issue of lead and the history of lead as kind of a paradigmatic issue regarding how we treat people in our society. I've written a number of books and articles about it. So I just want to get that very clear, that I come from this with this very, very brief little statement from the perspective of a historian, and also from the perspective of somebody actually who grew up in NYCHA housing. So I relate to this issue very, very clearly. I just want to point out historically some very basic problems. That we've had a century of knowledge about the neurological damage that lead inflicts on children. We have known about this issue literally from the early 1900s. We've known where the lead comes from. We know what causes the problems, and we know that children are going to be affected by lead if it's present in their environment. Literally millions of children in this country have been neurologically damaged over the course of the past century. Just want to get that right out there. The causes of these poisonings and the means of prevention have been well defined and clearly understood literally from the early 1900s. The medical and public health literature has detailed the terrible impact that this material has caused over the past century. I want to also point out that the lead paint industry was well aware, the people who sold us this material was well aware of this material beginning in the 1920s. They were talking about how children were coming down with convulsions and going into comas and dying from exposure to lead poisoning from their paint. They knew this literally from numerous medical and public health publications that were coming out in the 1920s, that children were very, very seriously affected. In Boston, Chicago, Baltimore, New York, Washington, every major city in this country was identified as having a lead paint problem from early 1920s onward, when the lead industry actually talked about this issue in their private meetings. Yet they sold and they marketed this neurotoxin that they called paint to cities and states around the country as a safe, economic, and clean means of covering all of our walls with it. That's why when Dr. Bassett says private and public housing has this problem, it's because literally every surface in this country that was built before 1950 probably has a lead problem, undoubtedly has a lead problem. Every house that is not maintained, every apartment that has crumbling walls, every apartment that has a leak will have a lead problem. That's the simple tragedy of it. The tragedy is that after this century, we have been foisted with this problem that the public has been given the responsibility for addressing it. I feel very strongly about this, that somehow every one of us, every part of our society has been held accountable for this problem. Mothers whose children and parents whose children are damaged by lead, public education systems that have been burdened with children who have neurological problems, hyperactivity, dyslexia, poor communities whose futures are continually undermined by this material, the welfare system, the educational system, every part of our society and the public health system have all been burdened and taking some form of responsibility. The fact that we've lowered lead levels so substantially over the decades is really a testament to the public's activity, not to this industry. The only part of this whole story that has been left out of our attempt to answer it is the industry that sold us this material, marketed it, and knowingly promoted it, despite the fact that they were identifying and saying that we are going to have this problem of lead-poisoned children into the foreseeable future, as long as lead is on the walls. They said this in 1920, 1930, 1940, 1950s, and we are still dealing with this problem. So that's the perspective that a historian has, that this is a tragedy of national proportions, and the fact that we've addressed even part of it is just a horrible a horrible legacy of this terrible history. The second perspective I just want to say very clearly is that as someone who actually grew up in NYCHA housing, okay, or at least my first 8 years of my life was in NYCHA housing, and who feels deeply appreciative of both the City of New York for providing housing for my family, and for the Department of Health, and for the various services that went into those houses. So while we can hold NYCHA accountable for all sorts of issues, and this is my own personal feeling, the simple fact is that it's the last 30 years of defunding NYCHA, defunding public services, saying that government in general shouldn't have any responsibilities and should have no funding because they should be shrunk. That is the root cause of this problem, because all of our housing is disintegrating, all of our public services have been starved. So I'm going to stop right there and just leave it open.
Thank you, and I think, sorry, I should turn this back on. We're going to entertain questions now.
Greg? I have like 50 questions. So
50 questions.
Start with one.
Well, he didn't have his hand up. Not yet, did you?
No, because my I don't want to use that word. My phone is screwed up. So, sure, I looked at all of those charts.
Yes.
And I didn't see 5 to 9 broken out. Do you have that?
We do, but you're right, I haven't shown that to you today. Right now, as you know, beginning on July 1st, we are treating every child who has a blood lead level that is 5 micrograms per deciliter or higher as a child who is entitled to an environmental investigation.
January this year.
We began this in January of this year in public housing. As you're aware, that was pursuant to the HUD guidance. In July 1st to be specific, the mayor and the speaker jointly announced that New York City would begin no longer considering who the child landlord was. All children with a blood lead level of 5 micrograms or greater will have an investigation. This is underway in NYCHA housing, and we are rolling it out in private housing. It expands our number of investigations from something like 850 to over 5,000 a year. So we're in the process of scaling up to meet that demand.
The CDC implemented 5 micrograms greater standard in 2012. And required an environmental exploration to determine the source of lead. And the City of New York declined to use that standard, used the 10 microgram standard through January.
Yes.
Why did the city choose to do this? I understand it started with Bloomberg, but it continued to do this.
Yes, so let me say a couple of things about this. One is that under our various mandates, Local Law 1, which was passed by the City Council over the objections of the Bloomberg administration and focuses on prevention of exposure to lead paint in the home, and our health code used 15 micrograms per deciliter as the trigger for environmental investigations. The department has progressively, as the number of children who met that standard declined in number, it progressively pursued non-mandated investigations using 10 micrograms per deciliter. As of July 1st of this year, we are going to be using 5 micrograms per deciliter. We are very pleased that we will have the resources to meet this new standard.
So the reason you didn't do it is because you didn't have those?
We have progressively sought to lower the levels at which we did environmental investigations to meet the demands of doing 5,000 rather than 850 investigations a year. Required additional resources. We're very pleased that we will have those additional resources, and that standard is now in place and is being implemented.
Yeah. The federal complaint says that between 2010 and 2015, I realize you weren't here, 2010, but it said that DOH identified 202 children living in NYCHA with elevated blood lead levels of 10 micrograms per deciliter or more, but that DOH inspected the homes of only 121 of those kids and did not inspect the homes of 81 of those kids. So that was at the level that you said did trigger an inspection of the home. I'm wondering why DOH did not inspect those 81 homes, if you've gotten to the bottom of that.
So that's a really good question, and let me try to explain it. As I indicated to Greg, what the department has done is focus its resources on progressively lower levels of blood lead as a trigger for an environmental inspection. But we use the level of 10 micrograms per deciliter or higher for children who were under the age of 6. Some of these children were not in that category. Also for even younger children, the children about whom we have the greatest concern, we used for children 16 months, 16 months or younger, we added children with blood lead levels of 8 or 9. We took it lower. But we continue to use 15 as the cut point for children between the ages of 6 and 18. So that has now changed. As of July 1st, the trigger for an environmental investigation is 5 micrograms per deciliter or higher for all children under the age of 18. The health department is very pleased with this new policy and very pleased that we have the resources to meet this increase in volume of work.
David. Commissioner, I wanted to ask, well, first of all, how many children live in public housing? You presented a rate, but have you been able to determine, how do you determine the number of children that live in public housing?
It's about 6%. I can't give you that number right now, but it's about 6 to 8% of children citywide. But I can't give you that number. I don't have it off the top of my head.
Extrapolation based on an assumption, or is there actually a count that DOH has done of the number of children that actually live each year in NYC housing? In other words,
yeah, I don't have anybody from NYCHA here, but I would hope that they're aware of the children who are leaving in their development. I don't have that number.
I guess that's my question. So in order to calculate the rate, DOH is relying on information provided by NYCHA about the exact number of kids that live each year, or a percentage of the kids?
I see what you're saying, and we can get back to you on that. I don't know the answer to it.
Okay, and one thing that does jump out in the data is that for the children under 6, but also for the children under 18, we see a flattening from about 2014, really
Yep.
from 2015 through
Yes.
today. It can't be lost on you. That's
Yes.
exactly the period that we're all have become familiar with through the federal investigation. To what degree do you think that flattening has anything to do with the lack of actual apartment inspections that were supposed to be done during the period?
Yeah. Well, I think that's Yeah, I won't try and flip back to the slide, but it's the slide, if we look for 2015-16, the numbers run about 170, 177, 160 in NYCHA housing. And when we look at it for the number of children under the age of 6, it similarly actually is literally 132, 131, 131, and that's what you're referring to as the flattening. There are two things that I would say about this. These are small numbers, and I don't know that, what we can say in terms of trends when we look at small numbers. The other is what I would describe as, the last mile problem. If you look at the trends, you can see that the rate of decline earlier on was steeper than it became. And as we push down the blood lead levels of children, and children live in the world that Dr. Rosner has described, where lead is present in their environment, it becomes more difficult to identify the particular sources. And we continue to work really hard at doing it. But I wouldn't describe this as causally connected. I would agree with you that in recent years, and it looks like 2018 is about on track to remain just a little bit lower. The numbers have not gone down as dramatically as they had in the past.
Just to say that, local law 1 is an important law for maintaining the safety of children in the city. And we see that when that law was not being followed, we didn't see the same sorts of improvements in lead health. And how can we say, how are you not concerned that there was some correlation there or is the law sort of useless? Essentially, you're saying
Well,
we don't have a law to protect.
all right, this is one of the things that's been a little confusing about the whole conversation around blood lead levels, which is what I'm talking about today. The health department receives all blood lead levels. We get all the tests. We're not affected by local law 1, which is a mandate on the landlords, whether public or private. If we have a child whose blood lead level is in excess of the standards that were used to trigger an environmental investigation, we go out. To the children whom we've been doing these investigations over time has now been added the 5 to 9 group that Greg referenced. As of July 1st, all of those children under the age of 18 will also have an environmental investigation. So that is a way of identifying potential lead hazards in households or other sources, as you know, probably spices and toys and other products may have high levels of lead. The health department has continued to do this day in and day out, and I think I'm very proud of the declines which we've shown you today.
Right, but the goal of the local law is proactive, and what you do is reactive, and so...
Yes, that's true, and local law 1, I think, is I'm not sure. I might have to defer to Dr. Rosner, and he may not know either, whether any other jurisdiction has a law that is as rigorous as New York City's, which says we're not even going to talk about a child's blood lead level. If that child is under the age of 6 and lives in an apartment, they deserve to be in a lead-safe apartment. And we're not talking that child's blood lead level, which after all is done at one point in time, is 0. We don't say, okay, we don't care about their apartment. New York City says that child should have their apartment assessed and it should be lead safe regardless. So I would argue that it has been an important contributor. We have seen declines in the 5 to 9 category over time, even when we weren't doing environmental investigations, and that no doubt is in part related to local law 1.
Your concern when you saw this flattening in that same period when the law was...
I noted it.
You noted it.
I mean, I looked at the data just as you have, and I'm, as ever, impressed that you've noticed it as well. I'm not sure that I can attribute causality to it because it doesn't, we can just note it and keep track of it, and we want to continue to do better. The thing that I would also note is that back in 2010, there were 425 children who had elevated blood lead levels using the standard of 5 micrograms and now it is down by nearly 70%.
That kind of goes into my story, Commissioner. People are watching on Facebook, and they've heard so many different numbers. The numbers have gone from 0 to 7 to 29 to then 800 due to some reporting. Will we know, is this the real story, is what people want to know? Is this the bottom line? And then is there a sense of regret? Do you have a sense of regret as the health commissioner, now knowing the full story and having all the numbers? And then why isn't NYCHA here? So it's 3 different questions.
Well, one thing is that we're talking about blood lead levels, which are the basis of the health department's mandates and which the health department receives. All blood lead tests are reported to us. I do regret the swirl of numbers and the confusion that swirl has generated, the different time periods at different levels. What I've done today is arguably added more to that, but our goal here is to demonstrate our commitment to being transparent about the data. These data will be publicly available. They'll be on our website. I don't expect anybody to be able to absorb and all of it instantly, but I'm hopeful that people will take the time to look through the data and look at them carefully. So in a sense, we're adding more data to the situation, but our goal is to make it very clear that the health department never attempts to scrub its data or mislead with numbers. We are committed to being transparent about our data, and these data will be publicly available and will continue to be publicly available. Well, because they don't have mandates based on blood lead levels, which is what I'm talking with you about today.
Amanda.